The Quantiferon TB Gold test, QFT, is a type of interferon gamma release assay, IGRA, used to detect latent tuberculosis infection, LTBI, of tuberculosis TB infection. The accuracy of the Quantiferon test is generally high, but like any medical test, it has its limitations. Here are key points regarding its accuracy. Sensitivity and specificity. Sensitivity. The sensitivity of the quantiferon test varies, but is generally around 75 to 85% for detecting active TB. This means it correctly identifies 75 to 85% of those with the disease. Sensitivity can be lower in certain populations, such as immunocompromised individuals, e.g., those with HIV or who are on immunosuppressive therapy. Specificity. The specificity is high, typically over 95%. This means it correctly identifies over 95% of individuals who do not have TB. High specificity reduces the likelihood of false positive results. Advantages. No need for return visit. Unlike the tuberculin skin test, TST, the quantiferon test does not require the patient to return for a second visit to read the result. BCG vaccination. The test is not affected by Bacillus calmette-guerin (BCG) vaccination, which can cause false positive results in the TST. Single blood draw. Only one blood draw is required, making it more convenient for patients. Limitations. Indeterminate results. In some cases, the quantiferon test can yield indeterminate results, which can occur if the blood sample is not handled correctly or if the patient's immune response is impaired. Lower sensitivity in certain groups. The sensitivity may be lower in young children, elderly patients, and immunocompromised individuals. Cost. The quantiferon test can be more expensive than the TST. Comparative accuracy. When compared to the tuberculin skin test, TST, the quantiferon test is generally more specific and less likely to give false positive results due to BCG vaccination or non-tuberculous mycobacteria. The sensitivity for active TB is similar, though the quantiferon test may perform better in certain populations. Clinical utility, latent TB. The quantiferon test is particularly useful for detecting latent TB infection, especially in populations where BCG vaccination is common. Active TB. While it can be used as part of the diagnostic process for active TB, it is usually not the sole test relied upon. Other diagnostic methods, e.g., sputum culture, chest X-ray, are also important. Summary. The Quantiferon test is a highly specific and reasonably sensitive tool for detecting TB infection. Its accuracy is generally high, particularly in populations without immunocompromising conditions. However, its performance can vary, and indeterminate results can occur. It is especially useful in settings where BCG vaccination is common, and it avoids the need for a follow-up visit, unlike the TST.